What's happening, guys? Did you know that the World Health Organization, WHO, WHO, labels a healthcare system as well functioning if it provides impartial access to quality healthcare regardless of paid dimensions while protecting them from financial consequences of poor health? We're going to talk about healthcare in the Philippines coming up. Hey, what's happening, guys? New subscribers, thank you, thank you, thank you. We're going to go into the healthcare of the Philippines. There's like 10 top facts on the healthcare in the Philippines, which I got this information online. The Morgan Project, which has, it's a blog which has the latest news and what have you. So, yeah, this pretty interesting. So the WHO, which is WHO, refers to the Filipino healthcare system as fragmented. There is a history of unfair and unequal access to health services that significantly affects the poor. The government spends little money on the program, which causes high out-of-pocket spending and further widens the gap between rich and poor. Out of the 90 million people, okay, living in the Philippines, 90 million, many do not get access to basic care. The country has a high maternal and newborn mortality rate and a high fertility rate, okay, which I think we all know that's true, okay. Which this creates the problem for those who have especially limited access to basic care, or for those living in generally poor health conditions. We all know in the Philippines, like, it's, man, it is so different. It's kind of scary different because, and I think it's sad that man, we'll get into that, whatever. Many Filipinos, okay, face diseases such as tuberculosis. This one here, I don't know if I can pronounce dengue, dengue, whatever. Excuse me. Just had a little sip of something here before decided to do this. Okay. Malaria and HIV/AIDS. These diseases pair with protein, energy, malnutrition, and micronutrient deficiencies. Okay. Which they're saying that particular thing is becoming more and more common now in the Philippine people. The population is affected by a high prevalence of obesity along with heart disease. Now, okay, I know about the heart disease thing in the Philippines. Yeah, there's a high rate of that, a high percentage, I should say, of heart disease. Obesity? Can somebody, like, look skinny and be obese? I don't know. That's interesting. I don't see too many obese Filipinos over there when I'm there. I can't even, yeah, I don't even think I may have seen maybe one or two, but oh well. Okay, so then the healthcare in the Philippines suffers from a shortage of human medical resources, okay, especially the doctors. That's interesting, right? Wow. That's interesting. But, you know, this makes the system run slower and less efficiently. I guess it would, right? I mean, if the doctors, you know, if they can't even get a hold of, like, human medical resources, that's interesting. Filipino families who can afford private health facilities usually choose these as their primary option. Private facilities provide a better quality of care than a public facility that lower income families usually go to. The public facilities tend to be in rural areas that are more run down. These facilities have less medical staff and inferior supplies, which I know that is true. Ernita and I have we donated things to one of the hospitals. I can't really remember which one, but yeah, we did that. I remember doing that. So that's interesting too. Yeah. Only 30% of health professionals employed by the government address the health needs of the majority. Healthcare in the Philippines suffers because the remaining 70% of health professionals work in the more expensive privately run sectors. There you go. Where the money is. That's where the money is. The better doctors, where the money is. So either way, yeah, that I see that. I see that over there. Yeah, sure. I mean, why wouldn't you? I mean, if you are a doctor, a surgeon, whatever, you're going to go where the money's coming in. So therefore, the other less fortunate hospitals suffer for that. So to compensate for the inequity, a program called Doctors to the Barrios and its private sectors decided to build 9 cancer centers, 8 heart centers, and 7 transplant centers in regional medical centers. Interesting. The Doctors to the Barrios, now let's print out, it's Barrios, I guess, Barrios, include public-private partnership in a plan to modernize the government-owned hospitals and provide more up-to-date medical supplies. And then we have more than 3,500 public health facilities were updated across the country. Although advances have been made to improve healthcare in the Philippines, there are still many issues that the country has yet to overcome to achieve a high-quality, cost-efficient healthcare system. So, there you go. Now, you know, I think it's interesting. I mean, most of us that go to the Philippines or they live in the Philippines, what have you, you know that in order for you to be seen, you got to pay up front. Everything has to be paid before it even happens. So, you know, recently, you know, we lost a fellow YouTuber, Mike, and from, you know, my Philippine journey. And, you know, I kind of wonder, you know, he had a bad heart. So, you know, I question, you know, did he get the proper care? You know what I mean? Did he get the best care for his situation, you know, for as bad as it was? You know, and these are things, you know, that I, you know, I question these things. I mean, I have had to go see a medical doctor while I was in the Philippines. I actually came from the U.S. to the Philippines already sick. I was really sick. I got a virus here, probably at work, because I deal with so many people in the public, and you know, so I was sick. So, you know, Ernita says, you know, you should probably go see a doctor and see if they can give you something, you know, an antibiotic or whatever. So we went, and the medication that was given to me, which was an antibiotic, had a great bad effect. I had bad effect with that medication. My legs started to break out, like it literally like chicken pox. If you know what chicken pox is, my legs were very They had red spots all over them. It was actually it was kind of embarrassing, and still today. Sorry about that, guys. Uh, Still today, um, my legs have been scarred from that medication. So, you know, things are so different, and you have to expect that. But it's very interesting with the healthcare. They clearly don't, they don't have the best quality care, I believe, in the Philippines. I mean, you have the government not helping, not backing. Excuse me, not backing anything. That makes it even worse. So, it's kind of like the people coming together to try to keep things going. That's how I see it. So, with donations and what have you. So, there you have it. 10 most shocking facts is what they're calling that. So, it is interesting, and that's I would love to be able to just pick up and just go and move to the Philippines and live there the rest of my life. But because I have had heart surgery myself, that's it's kind of one of those things where, yeah, no, I don't think I'd want to put myself in that position. I don't know. That's just kind of how I'm saying it. But we're always going to go back. We'll always be Filipino proud, you know what I'm saying? And it is definitely more fun in the Philippines. I can vouch for that one. Definitely. So, that's pretty much all I got on this one, guys. Leave me a comment. Let me know what you think. And tell me about maybe an experience you may have had while you were there when you had to go see a doctor or what have you. And yeah, subscribe, daggone it. I'm looking to get at least 10,000 subscribers. I'm already halfway there. So trying to hit a goal here. So love all you guys, and hit the like button and share the video. Till then, I'll talk to you later. Peace. Peace.